Hello everyone. I, Roshan Zehra, Assistant Professor from the IIMT College of Pharmacy, Greater Noida. Today, I'm going to discuss the topic suppositories with you. So firstly, I just want to explain the definition of suppositories. So what do you mean or what do you understand by suppositories? So basically, suppositories are solid dosage form intended for introduction in body cavities or orifices where they melt or dissolve for showing exact localized or systemic effect. So firstly, what are the body cavities? Basically, we use in 5 body cavities except the buccal cavity. Buccal cavity, or we can say simple words, mouth. So other cavities such as we can say nasal cavities, ear cavities, urethral cavities, vaginal cavities, and anal cavities. In these cavities, we can use suppositories. The main thing is that except the buccal cavities, all other body cavities, we can use suppositories. And basically, these are solid dosage form. This is also important. And they may be used for their localized or systemic effect. So they basically, we just insert the suppository in the intended cavity, and they will dissolve and release the medicament for their localized and systemic effect. So now comes the advantages of using suppositories. Firstly, I just want to discuss that it avoids first pass effect. So what is the first pass effect? First pass means the concentration of drug is greatly reduced before it reaches the systemic circulation, especially when the drug is administered orally. But here, as I've already discussed it with you, that we avoid, we cannot take the drug, suppository from buccal cavity, so it avoids the pass effect. Then the second advantage is melt at body temperature. So it will melt at the body temperature and release the medicament there. Then it gives localized and systemic action, and it can be given to unconscious patient. So definitely when we are just simply putting inserting the suppository in the body cavities, so it can be used for unconscious patients also. Various other dosage form like if I can say tablet or syrup or a capsule. So unconscious patient we cannot give. Now I just want to discuss the disadvantages of using suppositories. So first one, irritant drug cannot be administered. So what do you mean by irritant? Irritant means any drug which can cause a burning sensation. So irritant drug cannot be administered in the form of a suppository, and it need to store at low temperatures. Why? Because if we are putting our suppositories or keeping our suppositories at high temperature, so it will melt its medicament before insertion into the body cavity. Can't be easily prepared because some precision is required, and molding and refrigeration is required for preparation of suppositories. So it cannot be easily prepared. Cost expensive, as I've already discussed it with you. After refrigeration is also required for suppositories, and mold is required, and oils and everything. So it is cost expensive. Some drugs may be degraded by the microbial flora present in the rectum. Now, types of suppositories. So basically, suppositories can be divided into 5 types. First one is rectal suppositories. Second one is vaginal suppositories. Third one is urethral suppositories. Fourth one is nasal suppositories. And fifth and the last one is ear cones. So as the name itself is suggesting, rectal suppositories are meant to be inserted into the rectum. Then vaginal suppositories are meant to be inserted into the vagina. Urethral suppositories, or we can say urethral bogies, are meant to be inserted into urethra. Nasal suppositories or nasal cones are meant to be inserted into the nose. and ear cones are meant to be inserted into the ears. Now, the important topic is suppository bases. So base is very much important. Basically, our suppositories can be divided into two parts. First one is API. API means active pharmaceutical ingredient or the main drug, plus the excipients. And for the preparation of vaginal suppositories, bases is act as excipients or additives. So mainly bases are important for maintaining the shape, solidity, and just give a medium for which we can dissolve our API for the preparation of our suppositories. Now, what are the ideal properties of bases? So it must retain the shape and size of the suppository, should melt at body temperature, it should be non-irritant, it should permit incorporation of drug easily, it should be compatible with variety of drugs, it should be physically stable on storage, and it should not be softened or hardened on storage. Now it is the classification of suppository bases. So basically we divide the suppository bases into three parts. First is the oily bases, or we can also call it as oleaginous bases. Second is water soluble and water miscible bases. And the last one is emulsifying or synthetic bases. Now under first category, oily bases, there are few examples for oily bases, like we can say cocoa butter, or we can also call it as theobroma oil, emulsified cocoa butter, and the last one is hydrogenated oils. So cocoa butter or theobroma oil, it is the fat obtained from the roasted seed of Theobroma cacao. At room temperature, it is yellowish, white, solid, having faint, agreeable chocolate-like odor. It melts at 30 to 35 degrees Celsius. And this is cocoa butter is also we can use in cosmetic preparations like lotions, body lotions. It has vanilla-like odor. Then second example is emulsified cocoa butter. So emulsified cocoa butter or theobroma oil may be used as a base when large quantities of aqueous solutions are to be incorporated. Last is hydrogenated oils. Hydrogenated oils are used as substitute of theobroma oil. So we can either go and opt for theobroma oil or cocoa butter, or we can use some hydrogenated oils in the preparation of suppositories. For example, we can say hydrogenated edible oil, coconut oil, hydrogenated pea oil, stearic acid, and palm kernel, etc. Now comes the second part is water soluble and water miscible bases. For example, we can say glycerogelatin base, so glycerin base, or polyethylene glycol. So first, I just want to discuss with glycerogelatin bases. So it is the mixture of glycerin and water which is made stiff by the addition of gelatin. For properties, we can say that it is colorless, transparent, translucent in nature. It is very soft to touch, and again it melts at 30 to 35 degrees Celsius. And basically, it is used for vaginal suppositories, and vaginal suppositories are also known as pessaries. Then the last one is polyethylene glycol or macrogols. These are commonly known as carbovexes and polyglycols. These are available in solid state depending on their molecular weight. And the third and the last part is emulsifying and the synthetic bases, under which example we can say white spool, mesosterinium, and mesopol. First is white spool. So basically they consist of triglycerides of saturated vegetable fatty acid with varying percentage of partial esters. And a small amount of beeswax is added for use in hot climate. And Also, it should not be cooled rapidly as it will become brittle and fractured, and lubrication is required. So basically, if we are using white spole as a base, so lubrication of the mold is very much essential so that our suppository will not get stuck or will not get stuck to the mold. Then the second example is mesysternum. It is a mixture of mono, di, and triglyceride saturated fatty acids. It is a white, brittle, and almost odorless and tasteless solid. Now comes the method of preparation. So basically, we classified the method of preparation of suppositories into three parts. First one is hand rolling, second one is fusion, and the last one is cold compression. First, hand rolling. So it is the oldest and simplest method of suppository preparation and may be used only when a few suppositories are to be prepared in cocoa butter base. So hand rolling is simple. As in home also, if we are rolling or preparing chapatis, so hand rolling we sometimes we use hand rolling. So it is the traditional way of preparing the suppositories. So or in that case also we can use when we are going to prepare few suppositories, because for commercial manufacturing definitely hand rolling we cannot do. So firstly we prepare our API and then we add in a suitable base, which is also must be a cocoa butter base only. Then the mass is formed into a ball in the palm of a hand, then rolled into a uniform cylinder with a large spatula or small flat board on a pile tile. Then the main advantage of using hand rolling is we are avoiding the necessity of heating the cocoa butter in this process. So heating is avoided if we are simply hand rolling our suppositories. But the main disadvantage of using hand rolling is effective hand rolling requires considerable practice and skill. Only skilled person can hand roll or by practicing it again and again. Everyone cannot prepare suppository by using hand rolling method. So it requires some practice and skill. Second is fusion method. So fusion method. Fusion is something where we are mixing two things and that too with the help of a heat. Yeah, heating by using heating. So simply in this also, first step is melting the suppository base, dispersing and dissolving the drug in the melted base. Then the mixture is removed from the heat and poured into a suppository mold. Then we will allow the melt to congeal. And the last step is removing the formed suppositories from the mold. So fusion, again, we are dissolving our API part in a suitable base. Or first, where we are using heating, the very first step itself, we are melting the suppository base by by using heating. And after that, we will dissolve or disperse our drug. Then we will pour the mixture in the suppository base. We will allow the base and the API to set well. And the last step, we will remove the suppositories from the mold. This is all about the fusion method. And the last process is cold compression method. So fusion and cold compression method is same only, is not same, similar process only. The only difference between the fusion method and the cold compression molding is in fusion method we use heat, but as the name itself is suggesting a cold compression molding, so we does not use any kind of heating here. Simply, it is a compression method. So we form suppositories by mixing the mass, base plus medicaments, and we use some sort of machines, compression machines. And in these compression machines, we compress our mass into suppositories simply. So hand rolling, we use hand, only hand compression is there, and no precision and skill is required. Then fusion method, we use heating while making the suppositories, but while using cold compression method, the method is same only. We will dissolve, yeah, we mix API plus base, but no heating is required. We just make a mass of it and compress our suppositories into a desired shape. Now come what is about packaging and storage. So suppositories are usually packed in tin, aluminum or paper and plastic. So now why suppositories? Packing is why it is very important. Yes, definitely it is important because our aim is to be achieved. So till used, yeah, just before insertion, we have to make sure the suppositories are intact, are in form. Our main aim is that okay, after insertion into the desired cavity, it should melt at body temperature and release its drug. Prior to that, its shape and size should be intact. So, suppositories are usually packed in tin, aluminum, paper, or plastic. Poorly packed suppositories may give rise to staining, breakage, or deformation by melting. Both cocoa butter and glycerinated gelatin suppositories stored preferably in a refrigerator. So our aim is we have to make sure that it does not get deteriorated or deformed before its insertion. After its insertion only, it should readily melt at the body temperature and should release its content into the desired site, or we can say site of action. So as I have already discussed it with you, 5 types of suppositories are there, and the weight, volume, size depends on the type of suppository we are using, where they are going to insert. For example, I can say that if we are using nasal suppository, so definitely if I talk about the weight or amount of drug, definitely it will be smaller than the suppository intended to insert into the vaginal cavity. For vaginal cavity, the weight of the suppository or the amount of drug, definitely it will increase automatically. For age, also we can say that if we are going to prepare any suppository meant to insert in for pediatric patient, so size and weight of suppository will be less. Whereas if we talk about adult patients, so automatically size will be more, or weight of the suppository will be more. Bigger amount of suppository will be used. So any questions are there? So you can just type in the comment box. Method of preparation is also very much important. and the proper selection of the API and base is also critical in the preparation of suppositories. Or we always search for the very compatible base for the preparation of suppositories. As such, we cannot use any base for all the drugs. Compatibility, we have to search for the compatible drug. With the most, we will search for the base in which our drug is 100% dissolved, or we can prepare the suppository. So I've already discussed 3 types of methods are there. First one is hand rolling, fusion, and cold compression. Now again, I just want to recall you all with the types of suppositories. I've already discussed. Here there are basically 5 types of suppositories. Even for base portion, base plays a very much important role. So we have to get well reversed with the base also, because base, you can even say the base is the main fundamental unit for preparation of our suppositories. So we have to choose a base very wisely. Now I just again want to recall you all with the types of suppositories. As I've already discussed it with you, there are basically 5 types of suppositories. We can classify it as rectal suppositories, vaginal suppositories, urethral suppositories, nasal suppositories, and ear cones. For nasal suppositories, we can also call it as nasal boogies. Ear cones, we can also call this as ear cones or ear suppositories. Similarly, urethral suppositories, vaginal suppositories or vaginal bogies, and rectal suppositories. They may come under various shapes and sizes. And shapes and sizes, again, as I've already discussed it with you, it will depend upon the type. It will depend upon the type of the cavity in which the suppositories are meant to be inserted. So as we all well aware of that rectal, vaginal, urethral, nasal, ear cones, they have different shape and sizes. So we will prepare the suppositories according to the shape and size where we have of the cavity where we are going to insert our suppositories. So that's all for the today's class. I think you all are able to understand it well. Thank you.